Get into this story then. For the second time, the Tembisa Hospital has been struck by fire. This time, it's impacted the main outpatient facility. The latest incident follows the previous devastating blaze that gutted the accident and emergency unit, forcing the relocation of at least 50 patients. Now, in response to this concerning pattern, the Health Ministry and the Gauteng Legislature's Health Committee conducted an oversight visit to the hospital to assess the extent of that damage. Let's get that update then. The chairperson of the Health Committee, Advocate Ezra Letsoalo, to get first-hand account of the situation and immediate steps being taken. Advocate, thank you so much for the time. Really appreciate it. Why don't you just give us some background on what it is you saw and officially, of course, giving account as well of that second fire, which is very pertinent here.
Thank you so much. I'll tell you what, the committee descended almost immediately. I know I would have descended to Tembisa, over the weekend. But of course, formally, as the portfolio committee, we visited the facility on a Tuesday. But it would not have been for the first time that the committee would have undertook, a visitation to assess the state of the facility, as would be the case with any other health facility, really. And of course, one of our concerns, foregone concerns, with Tembisa Hospital, but with a great number of other health facilities, it's their aging, aging infrastructure, which is quite concerning. And in as much as the maintenance can be facilitated, not many things can be attended to, and hence we would have had conversations about the building of a newer, hospitals and so on. And so essentially we've raised, a plethora of concerns about the upkeep of the facility, and there has been some interventions towards that end. And what we'll have found, as it relates to compliance issues, was that there would have been some improvement from the previous years. And at the time of the fire, the facility was standing at about 79% of compliance, whereas the normal, threshold would be at 75%.
Wait, so ultimately you're saying that it was faring better than the state of some of the other hospitals in the country?
Well, if you isolate Tembisa Hospital on its own, we are saying on previous years, there may have been a major concerns about it, also as it relates to compliance-related issues. But what we'll have seen, as at the time of the fire, was that the hospital had made, somewhat of a progressive improvement in respect to a number of areas that there would have been cautioned about. And we found that, much interventions would have been facilitated. And I think we really wanted to commend the department on that.
Yeah. Do you know what would have been missing then? Of the 79% compliance that you had then, ultimately, what is it that wasn't up to par? What was it that wasn't up to standard, allowing for Tembisa Hospital to be vulnerable to these fires?
I think just the overall, security plan, the fire plan, which at that time might not have been as comprehensive. But what we will have observed recently was that you would have had the fire extinguishers, you would have had the CCTV. Well, not too sure as to whether it would have been fully functional. Otherwise, it would have been able to detect, the outburst of the fire itself. The cleanliness of the facility. So it's a range of issues that the committee will have laid its eyes on. And we really think there has been somewhat of an upward improvement on that end.
Has the cause of either of these incidents been found yet?
Not as yet. You still have got forensic teams on site. Investigations are underway.
This is the second hospital to have caught fire in the last, 3 years or so then as well, then Advocate. How concerning is this for you? Because that just means that it may be the fire plan, it may be the cleanliness, it may be the infrastructure of more than just these two hospitals that we then need to worry about, Charlotte Maxeke and now Tembisa Hospital.
Of course, we, as you can imagine, we are quite concerned. And I think in our engagements, one of the things that we were asking was also just about electrical networks, especially in the aftermath of the second fire, whether the power supply had been shut, whether, thoroughgoing investigations will have been undertaken. And one of the things that we have sought to do as a result of some of the delays in the investigation is that we have been referring to our sister portfolio committee, that is the portfolio committee on community safety, to follow up with the law enforcement agencies, because as you can imagine, forensic investigation would reside elsewhere other than with the department. We wouldn't want the department to be self-investigating. So law enforcement agencies should be able to come to the fore and help us expedite the investigations, including reporting, so that where accountability needs to be strengthened and enforced, that be the case.
It's not a budgetary issue, though, is it? Because surely it's a budgetary prioritization issue as opposed to budget. I mean, health receives still the biggest portion in South Africa's budget, but the prioritization may be the issue in order to build up and make better the infrastructure we have.
Well, it's a bit of both, because you can imagine, I mean, the burning of a facility implicates budgetary planning. And essentially, it would mean that you relook and have a rethink about how do you salvage that specific facility. But it's not only just the facility itself. I mean, there's inputs into that facility, which are sounding in millions. I mean, you have got machines, equipment, in certain instances, medication, all of that, that implicates the budgetary cover of the department. So part of our work would also be looking into how that implicates the overall budgeting, plans of the department, and how that it's likely to undermine the ability of the system to be greatly responsive within reasonable time frames.
So preparing our hospitals to be responsive then, how do we do that better? Because we're sitting with a situation now where ultimately patients could be fearing that any hospital in the country could have a similar issue at play.
I think the starting point really is just getting the right people to manage our facilities, and ensuring a greater accountability. Of course, the accountability linked with consequence management. And I'm really of the view that if you are to get competent people to manage our facilities, at least you've gone a mile in ensuring that you address some of the known challenges that ordinarily hospitals do come to face. But of course, overall, it's just strengthening systems in each and every facility, systems of accountability, ensuring that you have got the right kind of frameworks being actualized at every division of the facility. And I believe if you were to do that, you would be able to mitigate some of the prevalent challenges.
Is that to say that the management of our facilities is lacking in competency?
Not really so much, but I'm sure you will recall that there would have been a period where there has been a lot of lamentations about the kind of people that would have been deployed in different health facilities. Well, hopefully, with the advent of the new administration and with the impetus of the new MEC, we've seen a much, changes, much interventions in respect of, the deployment of, credible and competent personnel.
Getting all of that, however, is exactly the scenario we've been fighting or arguing or having protestations about, even in Parliament. One, having personnel in the form of doctors sufficiently for South Africa's health services as well. And then second to that is all the other auxiliary facilities that, of course, come in with hospitals. That just means that this budget is going to skyrocket in itself. Do you see the health department itself seeking and asking for even more money than it currently receives?
It should. I mean, health, priorities cannot be exchanged for anything. Really. And I'll tell you, the reality of a province like Gauteng is that every month you are seeing an inward migration of people coming from different parts of the country as well as outside of the borders of the country. So you can imagine the kind of burden that is placed on our health facilities. So annually, we do reflect on possible increments. Of course, the fiscus may not be allowing every time, but it's a conversation that is a continual. And I can imagine with, a facility being burned down, there will have to be some kind of conversations between the department as well as with the treasury.
What next then for Tembisa Hospital, Advocate?
So we have given the department a month within which to update. I know the MEC had committed a week within which to operationalize the accident and emergency section, having identified 2 sites within the precincts of the hospital itself. We're monitoring that, but ultimately we have given them a month within which to get those reports. And hopefully at that time, we'll also get somewhat of a preliminary report on the investigation that are underway.
In the meantime, of course, then the emergency services at Tembisa Hospital remains closed. Am I correct?
Yes, but like I said, I mean, there's a commitment that within a week, possibly, they could resume a functionality.
Advocate Ezra Letsoalo, thank you so much for the time. Appreciate it this morning as well, giving us a sense of things happening, not just in South Africa's